think one of the problem we have as physicians is we're so very much trained on the idea. I had this one doctor, I won't name his names, you know who you are, that he once said to me, you'll know when you become a great doctor when you can treat a person without ever having to look at them. And I thought to myself, I'm never going to be that person.
Wow.
But what he meant was that you gain enough knowledge to be able to extrapolate details from images and from labs and from this to be able to create the story. Okay, fine. But to me, that completely missed the mark of what my job was to begin with.
Right.
Because I've never had a person ever come to my office tell me, I'm here because I think my A1C is off.
Connect with us on the Emotion Wellness Podcast for a transformative journey of human connection. Witness personal stories, improve your mental health education, and acquire valuable resources for optimizing your well-being. And visit emotionwellness.com for more information.
Welcome to the Emotion Wellness Podcast. My name's Jason Turner. Glad to be back. And today is Frank's first time back on the new studio. Buddy.
Back in the new studio. It's amazing. It's the whole place is amazing. I mean, it's just...
We're going to talk a little bit about that today.
Yeah, the whole place.
With one of our favorite guests, Dr. Davila, Mr. Edwin. Welcome back, dude.
Oh, brother.
Thank you.
I think the last time we just did one with you not too long ago on the old studio. So... and then we have Nugget, who she'll make an appearance here probably.
Special guest Nugget, who's very loving.
And we've been talking the last couple episodes about getting Lars a microphone, and he got himself a microphone and a camera. So everybody say hi to Lars.
Lars is in the house.
He's our main engineer dude that keeps this whole thing going. And
yes, he does.
Allows me to keep my blood pressure low. And
and now we can shoot remote.
Literally one of those we can actually do really basic shit.
We can do remote.
I mean, Lars is an absolute incredible genius when it comes to this stuff. But yeah, we were struggling to do remote podcasts. So super grateful he's here. And
I have so many good guests for remote for us too, dude.
And so today I wanted to talk a little bit about Dr. D's role here. Become really good friends over the time that we've gotten to know each other. You've significantly helped me out. Both these guys. I've talked with Frank offline about this, but we'll get into that a little bit later. But just came off of a really challenging 6-month episode in my life where we put to the test some of the things that we're trying to bring to the table and help people. Hey.
It's gonna be cool.
Stop eating the furniture.
I honestly think it's gonna make the podcast.
No, it's cool.
Nugget's gonna be. I'm taking a picture with Nugget.
You got to tag your boy Mike.
100%.
So anyway, yeah, just we've really put to the test the things that we've been promoting, and 100%. It's something across our organization. You know, we live and breathe this thing. Every staff member engages in the practices and speaks from not only technical experience and evidence-based experience, but our life experience. And we're not always want to be careful of like taking advice from people who ain't drinking their own Kool-Aid. You know,
true.
So it's
100%.
So anyway, super grateful to start to engage in that conversation. We're in our new podcast studio, which is in our new private practice. And part of that is mental health services, right, on an individual session level. Still engaging in physiology and forum, physiology first, medicine, mental health with regards to red light. We're putting a plunge here, all the basic implements that we use to train our nervous systems. Yes. And then we've added your services for meeting with patients on a longevity level, lab work, all of that. So want to just start by asking you, what is it about this process, like besides our friendship and our connection, right? Like I know that's super, and I'm super grateful for that. But what is it about, let's just say, the emotion mission with your personal views on how people need to be treated, and then your goals for yourself professionally with your medical practice? Like, why are we so aligned? I'm just curious.
So The reason is because it kind of goes back to the very first time I walked in to emotion, okay, and talking about it at the center. And kind of quick step back, when I was going through my academic training for my master's in XPhys, for part of a project, I built a practice, right? Because I saw a huge gap in medicine. And just from observation, the traditional model of medicine has 4 walls. You do some vitals, you do some labs, it tells you you're fine, see you in 3 months. But there was never a measurement of how a person's ability to exist in the world was. What was their functional capacity? Are they able to do the things they need? And if they're not, how do we start treating that? Because, in the traditional model is I have this medicine to treat you, I have this procedure to treat you, and that's kind of where it ended. So I created a clinic where we still focused on the traditional aspects of medicine that I just talked about, but also had ability to measure the functional capacity of a person. And if they found themselves limited in certain areas, either neuromotor, cardiopulmonary, agility, flexibility, there was an extension in the building to start implementing that. That didn't exist as far as I ever saw. And when I walked into the first time, I was like, these guys built that. It's already here. It's in motion, and
It's actually
I just
emotion.
realized that. I just
emotion.
That was a layup. Dude.
That was completely late.
We did not plan that.
No, that was coming. I was like, and the fact is when I saw that, I just knew like this is what I've always envisioned, really in front of me. And the fact that when we talked and we all got to know each other, it was like we were all seeing the same direction. I was like, I needed to be a part of it. I needed to bring that element of my medical practice, my unique area, because you guys already built a gorgeous foundation, and it was just there. It was already there.
Yeah, and it's such a great connection and symbiotic relationship, because the element that I really was lacking was the medical side of things. I really didn't have that under our umbrella. We have psych, right? Psychiatric services. We have the mindset, the coaching, the physical, the mental health. We really didn't have a professional medical. And there's a couple of things that needed to happen. You have to find someone who is medically trained, but then has the same perspective that you do.
Correct.
Because just because they're medically trained doesn't mean they're going to be aligned with what I believe and what I think we all agree is the approach, the best approach in our minds for medicine and helping people. So super excited about that. And I just think of the team right here. It's like when I look at, I consider Frank a dear friend, but I also consider you like the king of comebacks, dude. You know what I mean? Like when you look at your process, it's having what I just went through with like the pain and the physical. I haven't been grounded. I mean, I was grounded as a kid a lot, but like physically, like health wise, I haven't been grounded my whole life. I've actually maintained a very active, quite intense training regimen for quite a long time. I'm 49, and up until 6 months ago, I hadn't ever been grounded, and it happened. Your process and your recovery and your mindset was with me from day one. If I didn't know you, I told you this, right? It was like my mindset was, I am going to approach every single day with, I'm going to get through this. I'm going to use gratitude. And I have visions of you in the bed shaking and like what that was like. And I was telling somebody today, if you've never been in a position as a grown adult who's used to functioning very independently and very active, and I don't just mean active like I train in the gym. I mean like I want to start businesses. I'm out doing stuff. I just have that, right? If you've ever been in a position where you are that, and then you can't put your own pants on,
Yeah.
Dude, people don't understand.
dude. And I'm not trying to say, look how elevated I am because of it. I'm just saying, like, there is a fucking perspective that I could not get a hold of. Yeah. It was outside of my realm until recently.
Yeah.
And I got it pretty intensely, but in comparison, and it's not like a who's got the most trauma.
I understand.
I'm just well aware that your experience was several notches in a different direction, more intense. But I think the mentality of I'm not able to take care of myself. You talked a lot about like, nurses wiping your butt and that kind of stuff. And
dude,
I just think of my girlfriend was putting my socks on. Like I couldn't cut my toenails. And that's not why this private practice exists, right? But what I think is why I brought it up and why I think it's important is we are using approaches and techniques like red light therapy, physical activity, supplementation, peptides, blood work, right? All of those things we used here. And in September, I couldn't walk. And in December, I was snowboarding.
Correct.
Yes, you
That's what I'm talking about.
Right.
And it's the same process that I went through, right? I come out of the hospital. If you notice, like I just did a reel, my face is all fat. I came right out of the fucking hospital a week after the hospital. After my transplant, I went and get a biopsy in my neck, and I'm walking 5 miles on a treadmill after. But it's that dedication, and it's the work that we do here. The sauna, the plunge, the red light, the meditation, the story work.
The breath work. Yeah.
The breath work. Like, dude, the other day, I mean, it still comes up. Like, I'm not Superman, you know, like trauma still reveals its head to me, and I need to still tap into the breath work. I called Jason. I said, I'm having a little bit of a episode here. You know, I get traumatic, you know, from everything that happened to me. It happens from time to time. And it's, how do I set my nervous? I focused the whole weekend, this past weekend, on just personal development, getting my nervous system grounded, all the things we do here. And when I came out of the hospital, I was on 11 medications. Now I'm on my anti-rejection meds. You know, I'm like the gold standard of heart transplant patient, because most patients are out here on massive amounts of medication. They're not moving their body, and movement truly is medicine, not just from a physiological standpoint, but from a mental health. Once I was able to start to hit the weights again, it changed my whole vibration.
100%.
It changed, and then once I started to see my body build again, it built that confidence within myself. You know what I mean?
100%.
And it's that's why I love you, Jason, and I love emotion so much, because it's who the fuck I am. Excuse my language, but it's like it's who I am. It's why I'm alive. It's why I'm in the mental state, and I've known that about you for years back when we used to be together years ago. I knew it. And that's why I'm so grateful for this, for what we're doing, for you coming, and we're doing this now. I mean, we're going to help so many people here.
What you just described is something I like to use simple terms to describe the big picture things in my patients. And I always like to use the example of a three-legged stool. Okay. And when one of those legs is off, the patient, there's no way you'll ever be balanced, no matter what. And there's three legs that I like to talk about when it comes to just general health: physical, mental, emotional. Okay. And when you approach medicine in its traditional sense, it's a lot of the physical. It's a lot of the objective data. So you're very strong on that leg. But as you said, there are some individuals who do not get that opportunity to start strengthening the other areas of mental resilience, the mindfulness, the emotional side, tapping into that which is affecting you the most. And when those things are left to just kind of eventually figure themselves out, the patient's never balanced. So they're constantly in this state of like, I can never feel like myself. So what you just described was the purposeful attempt to get all three of those legs perfectly balanced. You did it. That's awesome.
Grateful.
Yeah.
You know?
100%.
Yeah, I think I'm well aware of the challenge for people when it comes to using, lack of a better term, holistic methods. Or I remember waking up September 1st and not being able to move.
I remember you telling me.
It was level 10, and it was like that for like 5 weeks. And I'm not trying to be dramatic.
No,
it was just level.
Exactly.
I remember it took me 5 hours to get from my bed to the shower. And that day I was like, I don't know what this is, but it felt like everything was tight. I knew it was inflammation. It's just like, it has to be this flare up. I don't know what never happened to me before. And it took about 2.5 weeks, 3 weeks of like literally just getting up and then sitting in a chair and staring at the wall and being like, okay, talking myself into it, prayer, meditation, gratitude, right? And then I said, you know what? I'm going to do exactly what. There was a point where I couldn't. Like literally, it just, no matter what I did, I couldn't move. There was a point where I started to get a little bit of range of motion, and I'm like, I'm just going to go to the gym and literally sit on a box and stand up, because the sitting and standing was like a really big challenge for me. And I remember the day I did it, almost crying through the reps, like that much pain, right? And again, it's not to be dramatic. I'm sharing, like, I understand why people won't take this approach because it's hard.
Yeah.
Like and it's not like, oh, look at how wild and crazy I am. It's just, I desperately wanted to feel better. And I know I'm such a believer. I think for a lot of people, it's like, physical activity, movement, yeah, it's really hard. I just don't really see the benefit. I know the benefit.
Right.
We have firsthand experience.
Absolutely.
So I was willing to be in a ton of pain because I knew what was on the other side of it.
Mm-hmm.
And I'm telling you right now, 3 weeks in was it wasn't great. It went to like a level 6, but from 10 to 6, that's a huge. That was the best I had felt. And it was because I was actually moving my body. Mm-hmm. Right. Where medicine and technical expertise, and you have a serious level of expertise, came in was one, being a friend, right? I was able to access and call. And I think that's a big issue with medical care, right? 10 minutes with a practitioner is not enough. And I'm not trying to blame doctors, but you're in a system where, you're in a system. It's a revenue thing. I've got X amount of people I got to see to justify my salary and keep everything going and make a profit. When you slow that down and you move into like the private pay realm and you're able to like pay for services and you're able to get access to somebody with your skill set, we were able to have some really solid conversations, and you have somebody who's willing to commit time to you, right? And can. Mm-hmm. So there was this problem solving thing. It was like, it wasn't just here's your labs. Cause here's the thing. I'm pretty sure if I went to a regular medicine, because my labs were unique.
Were very, there was a particular area to it.
It was like when my labs did not speak to my pain.
Right. 100%.
And I know you had similar where you're telling me, I'm dying, dude. People
don't believe me.
Dude. Yeah.
The objective day is like, no,
you're fine.
This says you're fine.
You have pneumonia.
And it works like this in a couple of ways. One, I've seen it where you go in and people are like, you get your labs done. And I've never been to a general practitioner that looks at my labs and says, oh, your labs are in normal range, but let's talk about how to optimize them. That conversation has never happened. Mm-hmm. It's always, you're in normal range. Well, what's normal range? It's basically, you have nothing to worry about. Just keep doing your life. I don't know that's what I don't want that for myself. Right. I don't want that for the people that we take care of either. Right. So what he was able to do is look at the lab work and go, there's some, I wouldn't have been able to figure that out because I don't have that expertise. Right. But he's looking at my lab work and I'll let him talk to more about that. But there were these markers that really should have been there that weren't, in the realm of how much inflammation I was experiencing. And he knows me, so he knew that I wasn't lying. I wasn't med seeking. I'm not. It wasn't one of those scenarios that you could put a bunch of different variables in and be like, oh, sometimes people are lying. Sometimes it was legitimately like, I can't sit in a chair without wanting to die. I don't know what's wrong with me. Let's look at the record, right?
Yep.
And so, thank God I had access to his ability, and we were able to put together a puzzle, but it took a long time. It wasn't a fast fix. And I went traditional route, saw, a specialist, saw all these, and then I called them and I'm like, I got to do it my way, but I need your help. My way is like, I'm just going to do all the weird shit that I can do. Right. But I said, if I do that, I want to make sure that it's done right. So I started, right? You remember that phone call?
I do.
Yeah.
I know exactly where I was too. I was actually in Mississippi about to do a talk.
I remember.
And I was in the airport, and I remember we were talking, and I was like, okay, you know what? Totally, because the approach that the specialist took was appropriate. I want to highlight that but it was traditional in the fact that after we kind of looked deeper into what this could be, going back to what you said about the labs, is 100%. If I would have looked at your labs, never looked at you, let's just say I was completely blind to the person and just looked at the numbers.
And you were in that system where you had 10 minutes to look at them.
Correct. I'd have seen one marker that was slightly out of range. Everything else was normal. Move on. Times you gotta go. But because of our relationship and because of the unique way that we do things here, I was able to sit, okay, I know what I saw. I see the person in front of me. I see the baseline that I know, and now I see what's in front of me. This does not make sense. No. So, okay, these are gone. Clinically, what are we missing? And then when you were describing the nuances of your discomfort, the length of time that you were experiencing, and how impactful it was, like, this is an inflammatory issue, 100%. But why am I not seeing it on the thing? Why am I not seeing it on the labs? there, and that's why there was a unique area of medicine that we see this in. So without us having that communication, that conversation, that understanding of your baseline, understanding what you were going through, we wouldn't have had that. And then the traditional approach, which was the right approach, it was getting you there, but you highlighted a very important word: optimization. This works, but is this the long-term plan to get me to how I want to feel?
And what am I going to have to compromise?
Correct.
On the way there.
And sometimes we have to take a step back and say, okay, I have created a plan in the traditional sense that gets the person, like you said, normal. But how do they feel with this normal I've created with these different medications? Well, actually, I don't feel very good. Oh shit, did I achieve anything? Did I create a benefit to the person? I made numbers move.
Right.
That's awesome. But did I create benefit? And so when you said, you know what, I'm feeling better, but I know I can feel where I'm not where I am. I'm not at snowboarding level. I'm existing level. And I don't want people just to be there. So like, okay, well, let's do a different approach. And that's when we're on board. And we knew of a methodology of different kind of treatments that, yeah, I'd call them novel, but they are showing incredible promise. So we were like, let's give it a bash. And sure enough, the evidence speaks for itself.
Yeah,
It
lab
truly
work was
does.
all the way down. Like markers were, the one that was showing up was pretty minuscule.
And then on top of that, your functional capacity.
Yeah, and feeling the way that I feel.
Yeah.
And, you know, it was a combination of supplements that were designed to reduce, you know, like Baswala and some other stuff. And we were going with the methylene blue and some peptides and dosing and all the different things. And it was like, okay, this is, you know, and it didn't take very long.
No, it did
You know, we're talking, you know, we were joking earlier, but that retreat that we had for the Christmas party was the beginning of December. The Skyline semi-formal dinner was January 9th. And on the videos that we took, I look very different, you know, and what you said something very interesting, and it's primacy of all the stuff that we do, in the sense that I think it's what really makes the dial turn for any type of work with people is you said, I saw the person in front of me.
Yeah.
Being seen, right? Being seen. How important is that in recovery, healing,
Yeah.
your intimacy and your relationships? And so when you're in a medical scenario, although it's a doctor, right? And we happen to be friends, but like you wouldn't say that about every patient you see. They're coming to see you for a particular reason. But how vulnerable is it to be in a room with a doctor looking at lab work, you get what I'm saying? Like
100%.
we're talking about kind of a stranger, and we're going to dig into some of the most challenging information that your body's giving us, which could have really intense consequences or have meaning for you. And oftentimes people aren't felt, seen, or heard. How important is that?
Dude, extremely. You know, just from my standpoint alone, what I went through in the hospital and having, you know, Dr. Hernandez, I'm very close to him now, who's my doctor. Like, you saw this from the beginning, but even him, I've told him, I'm like, dude, you got to have more bedside manner with patients, because, like, we're facing death, dude, and a little bit of, like, being seen and more on the human side of things, because a lot of doctors don't have that touch. You know, I've built a personal relationship with him now, but I've seen, like, in the past with a lot of the stuff that I've done, it's like in and out. And it's like, fuck, you stuck with all this information. You didn't have time to even process it with them, ask questions, none of that. It's like in and out. And, you know, taking that time and having someone actually sit there and having some bedside manner to feel what the person's actually going through too. That's like such an important thing. You know, I saw a lack of that with doctors and more with nurses when I was in the hospital.
100%.
You know, way more with nurses, you know? Yeah.
I think one of the problem we have as physicians is we're so very much trained on the idea. I had this one doctor, I won't name his names, you know who you are, that he once said to me, you'll know when you become a great doctor when you can treat a person without ever having to look at them. And I thought to myself, I'm never going to be that person.
Wow.
But what he meant was that you gain enough knowledge to be able to extrapolate details from images and from labs and from this, to be able to create the story. Okay, fine. But to me, that completely missed the mark of what my job was to begin with.
Right.
Because I've never had a person ever come to my office tell me, I'm here because I think my A1C is off. No one said that. No one's ever said that word to me. No one's ever come to my office and said, "Oh, you know what? I think there's a stenosis of 65% or greater in my right carotid, and I'm here to talk to you about that." Like, no, you're not here for that. You're here because I think I'm dying.
Correct.
I'm here because I can't move. I'm here because the person that I know I am slowly or quickly getting away from, and I'm scared of that. Notice that has no number, that has no measurement, that has no metric. It is a feeling of who I am as a person. So if I fail to understand you as a person, I fail to understand when I've achieved anything. And that is an incredibly important, and it takes time. It takes time because not just because the complexity of a person, but the complexity of personality, of trust.
Yeah.
We as people, we value who we are so much to become vulnerable enough to question, will I ever be that person again? It's scary.
Yeah, it is.
And it takes, can I trust this person next to me with that vulnerability? Can I trust them to know I am scared? Can I trust them to know that they're going to be there at the way I need them? I don't know you yet.
Well, it's interesting you bring that up because, I mean, this was many, many years ago, and it's now circling social media again. It's funny how, things have been in place for so long, and then some influencer gets a hold of it, and it's like this new thing. When I was in school, which was a long time ago, the number one impact, the number one factor for the efficacy of a therapist and a client, do you know what it was? Rapport, relationship. It can't be the only place that's true, right? So if you think about, yes, we're dealing with physiology and medical stuff and issues, but if I have a deeper connection to the medical professional in front of me, if I feel safer with you, if I trust you more, I'm probably going to be more willing to do the things you suggest.
Absolutely.
I'm probably going to feel better about my course of treatment, which we know that's most likely going to have an impact on my ability to recover.
So it's funny you say that because it correlates directly to in medicine. Do you know what the most successful medication is for any treatment? It's the one the person's willing to do.
Yeah.
Compliance. But it ties right back to rapport because I have to trust you to say, I'm going to take this that I don't really know what this is.
Yeah.
You're just telling me that this is supposed to make me better. I'm going to put this in me. I have to know deep down in my heart of hearts that you have my best interest at heart.
Well, and it's hard to do that if I'm like, oh, damn, you spent 10 minutes with me. You barely looked at me.
Exactly, dude.
He doesn't care about me.
Exactly.
What is he going on? He doesn't even look at me. He doesn't know me. He doesn't know how could you dare give me this? Not even know what my goals are.
Yeah.
How do you know me?
You had to go through a ton of that shit, man.
Bro, like...
You're about to put a heart in me, dude. Like,
and I was like, in my head, I'm like, are you trying to get good stats? Because they know I'm going to fucking live. Like, and I was I was like, what's going on? That's why I talked to him after Hernandez, about all this stuff.
Yeah.
And now it's like, I won't leave Texas because he's here.
that's great. Yeah.
Do you know what I mean? Like, I won't go. No, I won't move because of him.
Yeah.
You know what I mean? And that's the relationship we've built over time. Like, I have his personal number. I don't think all his clients have that. Like, I have that relationship with him, but it's so important. And yeah, dude, there's a massive amount of fear. You got people coming in. I mean, I had more doctors coming. At first, I had, infectious disease specialists coming in. They're thinking I might have tuberculosis. Then I got the heart failure doctor coming in, telling me that you might need a bypass or a heart transplant. I'm like, you were in here 5 minutes. Then I got the arm wound specialist coming in, talking to me, cleaning, and it's like, and I got 5 minutes with these people. You know what I mean?
Yeah.
Crazy. Yeah. It was a lot of uncertainty and fear.
That's exactly right.
A lot of uncertainty and fear. But I believe, not to get off course, and we're just 1 second. I believe that God put me through and God's put you through what you went through because we're going to be able to help more people and be that shining light for others that are going through hardships. 110%.
So I've asked patients, and I'm going to ask you, and I'll ask you, and I ask everybody, the most impactful person to promote health, well-being and what can be done is never going to really be the doctor. It's the patient, because sometimes individuals feel, and rightfully so, that you're going, as the physician, you're going off a script. Of a script of education. You don't know, how could you possibly say you understand what I'm going through? How do you know I'm going to make it? How do you know I'm going to recover? You're just going off of your textbook. But when a person who's lived it, walked it, experienced it, and survived it says, you're going to be okay.
Yeah.
You're going to be okay.
It
It's
brings
an
comfort.
Well,
entirely different.
we see that in mental health where,
Even
when, I was at the VA and a lot of people, and it doesn't necessarily mean that you can't serve somebody, but the fact that I was a vet, that's the first question a vet usually will ask.
That's 100%.
Do you have that? How are you going to know anything about? And then with substance use, a lot of people who are clinicians tend to struggle, not because they lack skill, but because the person on the other end is like, well, you don't know, and hiding behind that. It's just interesting to me that what we're talking about is, I've always seen them very separate in the system, which is like the medical and the mental health. They don't seem to be connected.
You're correct.
Do you get what I mean by that?
100% agree.
And what we're trying to do is, well, not what we're trying to do. What we are doing is bridging that gap around this. Everything's under one roof, right? You don't have to go somewhere else. You don't have to, because it's really interesting. You go see a therapist. Not that it doesn't happen anywhere, but it's not the norm for someone, a patient, client, whatever the term is for that particular clinic that's treating mental health. It's not typical for them to sleep assess, look at blood work. I mean, that's just, blood work's almost never going to happen. They may assess your sleep. They may look at it. They're going to briefly discuss movement, barely.
Nutrition.
right?
Talking about diet. Yep.
Yeah,
Nutrition,
and the way that
supplementation,
every single one of those things impact your mental health. I mean, my lens, it's pretty clear. I see it as it's primacy. Physiology is primacy. That's the number one thing. It affects all other.
Absolutely.
Physiology impacts behavior. It's going to impact the psychotherapy that you're going to do, and certainly going to have an impact on your lifestyle, like what's going on, right? So, Doc, talk to me about what we're able to, like, some of the services that you're able to provide here, that that you'll continue to do when you're completely free of other areas that you are performing medicine in, and then how. Let's cover that, and then I want to talk about how that aligns with mental health at the end.
Sure. So to kind of go back of how you mentioned separation of mental health and traditional medicine, I saw and continue to see there's a separation between physical exercise science, the application, and traditional medicine. And it's so weird because now it's become the latest topic, as if it's this novel thing where you're seeing individuals start to incorporate exercise principles into their practice and say it's new. It's not new. We've been doing this for 30, 40 years. But the problem is that we've seen its benefit in the athlete, because again, sports medicine, exercise science, and we did that because we wanted to optimize performance. The difference between gold and bronze can be a millisecond. Mm-hmm. Getting on that podium could be this much. So you need to optimize a person to the nth degree. Mm-hmm. But what we fail to realize is that everybody is dealing with performance issues. Everyone's an athlete. Usually your sport's just different. Mm-hmm. So by taking the applications that we know and we know that work and beginning to evaluate everybody and then seeing where their limitations are and working and creating a plan to treat each one of those areas, you actually begin to optimize them in ways they weren't expecting. So to say this, what we do is we look at at least five different tenets: neuromotor, musculoskeletal, agility, flexibility, and general labs and wellness. So for instance, we do VO2 testing. Okay. We do resting metabolic rate. We do 3D body composition analysis to determine the kind of different variations in a person's body mass in terms of muscle and fat. We take these elements. We are going to start incorporating both those neuromotor testing via our light wall. We'll have the ability to do red light therapy, sauna therapy. That'll be for other elements. And we're going to measure all of what the patient is able to show us. If they are limited, for instance, in flexibility, they're limited in their strength, and they have a low VO2, we can create a plan around that, see and measure over time, and not only show the person you're feeling better, but here's some measurable reasons why. So it gives them a tangible thing like, okay, I'm feeling this, I'm seeing this, and I'm measuring this. And so that's at least one element to that. And then, of course, there's the other side of the coin is, you already kind of made mention of it, dietary habits, exercise prescription, dietary modification, supplementation are key components. They are some of the most important elements that actually feed all those other areas. Very rarely are they ever discussed, and very rarely is ever a customized plan ever really provided. So to sit down, talk to a person, find their habits, find these areas that they are struggling in, and sometimes, many times, as a person, all of a sudden, after you sit down and have a very detailed discussion about their dietary habits, they find out that, oh my goodness, I didn't even notice I was eating this, doing this, consuming this at this level. And you make small alterations that fit their unique lifestyle, and they can incorporate it more easily. They see the benefits there too. And while, the understanding of nutrition is something that's kind of very basic, I would argue that more often than not, your traditional physician, if they're going off of just traditional medical school, has about a weekend at best worth of knowledge, of actual teachable knowledge of exercise and nutrition. And thankfully, I was an exercise physiologist first before I became a physician. So we bring all of that background into here. So we create that customized kind of plan.
Well, it's such a great thing to bring up because your background and your experience, it's like a very unique combo that gives you a unique perspective. I feel like for me, it was athlete clinical training, right? Like I became a therapist, I had an athletic background. So that unique experience is what's allowed you to really thrive in how you treat people, because you have the experience where a traditional medicine doctor doesn't get that training. They have to go seek it on their own or that type of stuff, but you came to the table with that.
We know so much that a person's function, you said it, you already said it, Frank. When you were walking around the hospital with your IJ still in your neck, okay? I know you know this, but I don't think people truly understand how that simple act was monumental to your success and your health and your recovery.
Huge.
Because more often than not, the goal in that scenario is just get the machine balanced. Don't worry about motion. That's not important. Don't get them up. Don't worry. They might stress them. Not realizing that the longer the person is maintaining that just kind of hovering, that very sedentary, not the lack of motion, things are breaking down. We're losing ground. We're losing that function. So the second that other person, that other poor soul that didn't do what you did, comes out of the hospital, they're so behind already. Then they have to catch up so much. By you incorporating those elements in, you were so far ahead. And that's the thing that I think people need to be reminded and addressed, and actually have a step back and ask, how much am I moving every day? How much am I standing every day? What part of my diet is real food? What am I consuming that's more an amalgamation of things that look like food-like substances that aren't actually real
food? And
we don't talk about that, but here we do.
Well, and what's interesting to me is, and it makes a lot of sense when you dig in, and it's probably for another show, but what gets talked about a lot is the benefit of movement, but what people aren't really talking about is the detriment of sitting still. And I mean, not just like, oh, it's not a good idea. I'm talking about evidence-based research studies that show the health of people who are sedentary. It's absolutely astonishing how bad it is for you. But everything in our current modern society is about the couches are real comfy, the TVs are real big, the shows are really engaging, and the phones are real attractive. So we've got a whole bunch of stuff, and I can sit on my ass all day, watch TV, and have food delivered to my door. So we
can't even go out no more.
We've really technologically advanced ourselves into this crisis that I don't think a lot lot of people are aware of.
They're unaware.
That's a good idea to move. No, it's actually a fucking terrible idea to be sedentary, meaning on par with smoking cigarettes. There isn't a whole lot of difference between the two. In fact, there's some stuff I read years ago where it was like they were looking at people and it was actually better to smoke and exercise than it was to not smoke and not move. Mm-hmm. I'll say that one more time.
Yeah.
Smoke and exercise produce better results than not smoking and sitting still or being sedentary.
Mm-hmm. And I have at least it's my personal belief, why that is still such a crazy concept to most people. It goes back to what we said. Traditional medicine, plenty of education as to why cigarettes will cause significant impact to vasculature, pulmonary, cardiac, and the like. Very little education as to what motion does for the body. And you're right. We're starting to see, again, a good point for another episode, but we're seeing it in every area now in terms of the heart. The American College of Cardiology in 2023 put out a wonderful paper talking about the impact of low muscle mass and its increased risk of cardiac related death. It was the first
low
time,
muscle mass.
Low muscle mass. And it was the first time you really started to see in a journal like that comments about things like anabolic resistance, increased inflammation, decreased blood flow to affected regions, something called sarcopenia, which we can talk about later, and it would be fun, about how all of those elements show a substantial increase in death and related, and not only just death, but decreased quality of life. Mm-hmm. Jump into another system in the United States and globally now, we're starting to see an incredible rise of fatty livers being the number one cause of cirrhosis and cancer.
I've seen that.
Yeah. And the fact remains is that one of the most important tenets in able to try to decrease that risk there's very few medications that can even help. But the two most powerful things is what are you consuming and how much are you moving? Mm-hmm. Mm-hmm. And that's just two quick areas. We can go on and on about it.
Mm-hmm.
Well, I think the bridge to the mental health piece too is, a lot of language that we are incorporating and that I'm pushing hard, whether it be on content, but that's great. We talk about it on the podcast anytime I get a chance, but within our center is where it's really important, right? Because it's about the clients and getting them to see it differently. We've eliminated a whole bunch of words and terms that we don't use as a team. Like as a substance use program, we don't use clean or dirty, that type of stuff, right? Because they have meaning and they impact you, right? We use words like training versus treatment, because what we're really doing is training, right? So, and the people that are coming to see us that are usually in need of the most help, they don't realize it, but they've been training for quite some time. They just didn't call it that. Right? So there was consistency, there was repetition, and it usually involves things like, I'm getting older. I'm just weak. I'm just an addict. So whatever the story is, right? This story that we have. And so if I'm somebody who isn't walking in the hospital and now my new norm is I lay in the bed all day, it's like, I start to tell myself this is just how it is. Well, if this is just how it is, then guess what? This is just how it is.
That's right. Versus
challenging the evidence or creating new evidence, right? So if I'm out walking every day, the narrative is I'm alive. I'm moving towards something. I'm healthy. When you start to look at, if I were to ask you, what does it mean about you that you're laying in bed all day after you had a heart transplant? You may come up with any number of things, right? But if I say to you, hey, what does it mean about you that after you died and you got a new heart and you were walking around the hospital 5 miles a day, what does that mean about you?
That's right.
What does it mean about you?
I'm a fucking warrior.
Yeah. What does being a warrior mean about you?
I don't never give up. I'll never tap.
So what do you notice when you say that?
I feel energetic.
Yeah. Now, if you were laying in bed and I said, what does that mean about you? It means I'm dying.
That's right.
Right?
Yes.
So if I start to repeat that messaging,
yes,
like be very clear.
Yes.
Everyone listening.
Yes.
We all know this in the room.
Yes.
What I'm telling myself is the reality that I'm creating.
Correct.
Right?
Correct.
And so what we're able to do and why this is something I think in medicine, if you're saying most medical practitioners don't have a lot of training in what motion does for the body on a physiological level, that's one thing. But let me explain more in depth on a psychological level. The body's coming in the door on autopilot. We all think we're making these choices, but a lot of our stuff is automatic. The subconscious is driving the bus. We've got core belief systems that tell me that I'm not worthy. And most of our patients are going to circle with things like, well, I know what I need to do. I know what's wrong. I just can't seem to do anything about it. Well, that's kind of what we're saying, is that you can't outthink your biology. Like you're not going to move. Insight's not going to change that. You have to train it differently, right? So then I start moving my body. So physiology starts to change, neurochemistry starts to change. But on a psychological level, what starts to change is I now have evidence to this long-standing belief system that I'm a worthless piece of shit, or that I'm weak, or that I can't do it. And now I start to feel like I can. Simultaneously, I'm literally training, ingraining into my nervous system resilience through rewiring, through brain processes, right? And the nervous system. Mm-hmm. So my nervous system is learning how to tolerate controlled doses of stress. Mm-hmm. I'm challenging a belief system about myself that I can't do it, that I'm not supposed to do it, or, and if I had a nickel for I'm not taking aim at the medical fraternity. I'm not.
I do.
But if I had a nickel for every time I heard a client of ours come in the door and be like, oh, yeah, my doctor told me I'm not supposed to.
Yeah.
Pressure on my knee. I'm like,
yeah.
And I'm not a doctor, but I'm the one in there going, your knee hurts because you don't
move it. That's correct.
100%.
That's correct.
Literally, that's what's happening. Yep. You're in a cycle. I don't move because someone told me don't put pressure on it.
And I can't move.
But the more I don't move, the more I reinforce the story that I can't move. And that it's not that I can't move, it's that I don't move. And now I'm lazy, I'm out of shape, that's not who I am. And then I start to repeat that narrative. And guess what happens? That becomes my reality.
And then you're 60 years old, and because you didn't move, you can't move no more.
Well, and the more that you don't move, the more you feel like shit. And the more you feel like shit, the more you increase the narrative of feeling like shit. It's this vicious cycle.
And same is the true for the opposite.
100%.
You invest in your life, you invest in your health, you invest in your mental health, you invest in your emotional state, you invest in your spirituality, you upgrade from upgrading, your circle upgrades. Yeah. The more you upgrade that, the more your circle upgrades.
But what you're talking about requires training and preparation. Absolutely. Right? It's hard to take somebody from a low self-esteem, low worth position and then put them in a position of wild success, because they'll most likely will do something to destroy it. Mm-hmm. And people call it self-sabotage. And I just say, well, no, you just selfed yourself. Yeah. Like you just showed up like you. Not that it's a bad thing. I'm not coming at people with that. You just showed up with your conditioned nervous system.
Yes.
So let's retrain the nervous system.
Correct.
We need to how am I going to do that? Well, we need to look at lab work. We need to look at what's going on with our blood. We need to look at what supplements, because a lot of people are coming in the door. I mean, let's be honest. I got friends in the supplement game. I've been an athlete. I've taken plenty of them. Most of it's total bullshit.
100%.
Like 86% of what's out there is absolute garbage. So helping our patients take a look at, like, we can put them in front of doc, which he's willing to do, and be like, hey, bring in the stuff that you're taking, and let's see what he seems to think about it, and maybe give you some direction elsewhere. People don't understand how caffeine's impacting their sleep. They drink later in the day, or they're eating after 8 o'clock at night, or the screens and the way red light affects it. So all of these things are pieces to a puzzle that if we're just looking at, and this is the mental health connection, if we're just looking at psychology, it's only a drop in the bucket of what else needs to be addressed in order for the psychology to really take hold.
Yeah. Sometimes people forget too, a lot of the hormones, if all the hormones that we produce in the body, originally derived from an amino acid. So if you're deficient in a base core substrate, you are going to be deficient in its product. So if you are not fueling the fire, you don't have enough wood to make the fire. It's always going to be just this dull little ember that never goes anywhere. So that's a base right there. And like you said, supplements, I've been in the supplement world now, God, going on about 22, 25 years. And I remember I wanted to gain a stronger sense of understanding. That's why I went to get my master's at it. And I was very fortunate in finding how God takes you in the right direction to the right people. And I was able to train under who I would consider to be one of the juggernauts of the entire field of sports science. His name is Dr. Darren Willoughby. And his lab used to have a nickname, and it was the place supplements went to die. And it's because he would get contracts from some of the biggest names fully just to confirm that the product worked. And everyone knew if it came from Willoughby's lab, it's going to be honest.
Right.
And more often than not, it's like, thank you for it. Here's your data. Doesn't work.
Yeah.
And here's your reason why. And nobody ever fought it. Why? Because at the end of the day, people want to say our product works. And not to say that there's supplements out there that don't work. They're out there. But like you said, it is a small portion.
And don't you think, and you would know more about this than I would, but I mean, I definitely have some information on it where even if it has components or ingredients that are effective, it's usually the dosing is not accurate.
100%.
It's like a different dose that's not really going to produce the result.
Exactly. There is, anytime you're doing anything with any kind of medications, supplement, anything you ingest, the question is it at a level that, for one, has the dosage of showing benefit? 2, does it achieve that dosage when it gets to where I want it to be?
Bioavailable?
Is it bioavailable? 3, is the way in which I'm consuming this actually going to stay what it is, what I need it to be when it gets there?
Right.
Then what I mean by that is, see, people will use as an example of one, just something out there like NAD. We'll go with that. Why not? Because that's a big popular thing right now. Does it show benefit? Absolutely. I think that there's a lot of promise. Is me taking NAD in a pill the same thing as NAD I inject? Absolutely not. Because all the different steps the body goes through when you do something orally versus injection is completely night and day. So I didn't say it doesn't work, but the method in which it is administered, the dosage in which it's done, and the frequency in which it's given all have to matter. So when people invest their trust into something that will give them the goal they want, they need to know that I am doing it knowing all of these things have been looked at. And I understand, and I have that backing to know that I'm doing it the right way.
Well, back in the day when I was like, bodybuilding and just, I think this way now, but I didn't back then. If I'm putting my money into something, I really want to make sure it's working. Back then it was like, oh, I just saw an ad, or I hear from a friend. Or like half the gym is taking something, right? So you're on it. And we have a lot of patients who fall into that category. So I'm really grateful that like you are someone who will give them education. In fact, today you're doing a talk at the center, right? What's the title of the talk?
It's called Supplement Myth Busting. The goal of it is to describe, yes, that there are supplements out there that provide true benefit in everything from mental health to cardiopulmonary ability to general strength. But then there's also ones out there that is a bunch of snake oil. And then there's some out there that are working, but not why you think they're working, because what's in the bottle isn't what you think is in the bottle. Right. And so there's all these things that need to be discussed, because, when people go and approach this, they're putting your money into it, you're putting your trust into it, you're putting your body involved with it. Is this doing what I want it to do? Well,
and there's a couple different approaches, right? Like as a program, we could say, don't do this. You put boundaries in place. I've never found that to be very effective as far as like coming in and policing. Yeah. So for us, it's let's educate you. And we're so grateful that we get an opportunity to have you spend time with us to basically run an education. It's a psychoeducation group for our outpatient group where clients get direct access to drill you on questions and use your expertise. And I feel like, and I know for a fact, in all the areas in which we've given information and provided facts, like when we start talking about the survival system and how addiction, the process really works, and you start to have them focus on their physiology and their biology, the shame starts to just melt away. They still have work to do. It doesn't just go away, but it definitely lessens, because now there's an explanation as to why they're doing what they're doing. And they want to engage more to do differently, right? So I feel like the same thing with the supplements. It's like, hey, you guys don't even realize like half the stuff you're taking. First of all, you're wasting your money. It's not a good use of your limited resources, because some of our patients are, limited budgets and they're trying to get their life together. There's this willingness though to just fork over when we think that it's like going to do something for us. And so giving them an opportunity to see differently, I think it's really beneficial from the standpoint of, now I'm going to start to pay attention to what I'm putting in my body 100%. And learning how that relates to my mental health. So then that translates into the food that I take, translates into the music that I listen to, all of the things in the way that which we show up are impacting our physiology.
That's right. You said something that I think it goes super important to anything of care, is never to tell anybody, this is bad, don't do this. Policing somebody is more often than not, it's going to fail. Instead, it's like you said, be a location in which evidence-based knowledge, medicine, and application is where, when you go here, that's what you're going to get. I will take from what you all say and I'll make my decisions, but I know that the information you're giving me is valid I know it represents what my beliefs are, and I feel like if I have questions, I can then put them out, and they will be responded to with respect, and that's exactly what we do.
Yeah, I love that.
Yeah.
Yeah.
From levers, right? Different levers for supporting a patient seeing the private practice or mental health group therapy. When we talk about medical intervention, what are some levers that you feel are really important? Like I would say, obviously, inflammation, metabolic. Like just wanted to. We have a couple minutes left. I know you got to get somewhere too.
So when I approach anybody, first thing, and I'm trying to be cheesy, but just be honest, is what is it that brought you in the door? What is your goal? What is the thing in which you feel is limited, if anything? And there's always something. No one's ever feeling like I am exactly where I want to be all the time. No. Or it's that one rarity. It was like I am where I want to be and I want to hold it. Okay, great. We're good there. Second thing is tell me about your day-to-day life. I want to know what the amount of activity that you all do. And that's meant to give an understanding of somebody's functional capacity. How much do they move every day? What is the barriers of that movement? How is it that we are able to have balance in something in terms of the day-to-day? Thirdly is tell me about how you feel in terms of your activity level, in terms of energy, in terms of, okay, so that helps me understand dietary. These are all the subjective. I always start, my first lever is subjective. Everything I want to know what the person feels, and I'm pulling from there, seeing where I think some of the gaps are. Okay. Once we have all the subjective, now we switch over to the objective. Now I got to we start doing the measurements to be able to see, okay, the feeling you have is this, where is the deficiency? Is it in the cardiopulmonary? Is it in the musculoskeletal? Is it a flexibility issue, an agility issue? Is it a neuromotor issue? What is it? And then we measure all of those elements, finding ways, okay, like you said, the report card almost, if you will, the yellow, the red, the green, where are we finding those deficiencies? We see where someone's strengths are. We see where their limitations are and where we can start showing improvement. And then we start creating a game plan, knowing that we didn't get somewhere overnight more often than not. So the goal is not to make a 30 days or your money back guarantee. You lose 30 pounds in 30 days. No, it's none of that, because that's gimmicks. That's not longevity. That's not life. That's not improving the functional capacity for the long term. It's okay. This is where we're starting. This is what we're going to expect. If we don't see it, we're going to adjust. And if we get there, great. This isn't where we're stopping. We're going to continue to go. We're going to keep measuring. We're going to keep adjusting. We're going to keep doing these. Because you said, and I think that's the most powerful thing I've heard in a long time, is we don't treat, we train. That is such an interesting. I've just been sitting here thinking about that right now. Is that treatment in of itself gives this connotation that I am at a bad state and I'm just trying to get back to baseline. Whereas training is I am constantly moving forward to achieve that which I did not have before. And that never stops. And that's a good feeling.
Yeah.
So that's kind of where we are, at least in that kind of stepwise process.
Yeah, I mean that's what we're training capacity, right? And giving people an opportunity to regulate and make the high-low swings that are driven by nervous system, either lack of calibration or calibration, getting them tighter, right? So how long does it take somebody to get activated on an emotional level and then come back down to baseline? Which we know, I see this in the gym, mirrors how long it takes somebody to get their heart rate up and then come back down, right? So like the more fit that generally the shorter the window is on the heart rate coming back down from metered or dosed stress, right? In the gym, we see the nervous system start to change as well. And it's absolutely incredible. So super grateful, man, that we connected both from a professional standpoint, but just getting to know you. We talked on the last show about the privilege that we had to work with your mom and the trust that you put in.
She's still coming.
Yeah, we got to get her on the show too. Yeah. And then just again, to you both, thank you for guiding me in the process to help me get through the recent medical stuff. And I'm not out of the woods yet, but I'm pretty feeling
doing good, dude. You're squatting.
And then your example, dude. I know that you are that way on social media and you've set yourself up and and you promote that, but just from someone who's literally on your inner circle, need to say it out loud, is like, your example helped me. Like, it was really the reason why I went from, when this thing happened, day one, I was like, I literally said this, I'm not going to let my pain, no one's going to know that I'm in pain because of my attitude. Like, no one that really, it's work and a couple of my small friends group, but nobody in my employ is going to know that I'm not going to be an asshole to anyone in my circle because I'm in pain. Yeah. And I feel like historically that's been the case, right? Like I justify it, and I think a lot of us do. It's like I'm miserable and I'm just projecting that misery. So that was number one. Literally, when I opened my eyes and once I got my bearings around like what was happening, I'm like, oh, what would Frank do? Right. Yeah. And I knew that, and I felt bad. I would just call him literally and be like, dude, I'm not comparing, because I know, I'm just letting you know you're somebody who understands this shit, but please know I'm basically going to like what I would consider the overcoming pain God, right? Because he's like, I mean, really, like, it was like you were like I don't have another example in my life. Like, it is the most intense experience that of all the people that I know that survived, right? And so there's other things that could top your story, but I'm saying for me,
right? And you like
it is the most intense story experience that I've had the privilege of witnessing, being part of, and sharing with you. And it got me through, you know, literally did. It was like, without it, I'm not saying I wouldn't be here, but man, it allowed me to really challenge myself every day. Because I'm like, bro, what am I gonna do? Call up Frank and be like, emotional. Be like, yo, Frank, I'm having trouble getting out of my chair. And he'd be like, yo, fuck off, dude, I just got a heart put in my and you get what I'm saying? Like, so we laugh at it, but it's what helped me get through, right? So and your guidance, and, you know, dude, Doc answered I was calling him all the time, texting him, hey, I want to try this. And then he did the thing where he'd give me the thing and dose it. And I'd be like, okay, well, if 2's good, 4's better. I'm gonna try. And then I'd call him and be like, I feel guilty, man. I went above. Is this going to mess me up? And then I'd dial it back down. And so really thank you and obviously the whole team supported me. Like I have an amazing scenario with emotion, and very fortunate. I was super grateful because I'm like, I have access to sauna every day, plunge. There wasn't any reason.
How about you're not working for anybody? You're working for yourself too.
There wasn't any reason for me not to get through this, in the sense of like, I got my own schedule. I have access to all the shit. It was impossible for me to feel sorry for myself. But I also think, just like you, people see those stories and maybe wonder, oh, I could never be that way, or I could. But it was training. Like I did a lot of story work. You've done a lot of work on yourself. Dude. So that mindset just doesn't happen overnight. No. It isn't a treatment that gives it to you either. No. It's a training protocol. It's a training. Every day you show up and you train yourself. And some days it's like I'm in the red, some days I'm in the yellow, and some days I'm dead on target, right?
Brother, every single morning in that hospital bed, my friend Jamie, rest in peace, he was a rapper. He was blowing up. They made a song, Love and Life, him and Blizz. And I would listen to the fucking song every morning in the bed. I woke up loving life. And I would say to myself, you're a fucking warrior, son. Get the fuck up. You're a warrior. And I will fucking walk. I had the nurses, one of them was heavy. She couldn't keep up with me. Like after a while. That was my goal, to make her tired. You know what I mean? Because she was walking me. They would have to hold me with the thing, you know, because I had my balance. But then I started to go, and I would have someone have to walk me, and she would get tired. They'd have to pull in the, you know, relief pitcher to walk me more.
That's awesome.
I want to say you said something about access, and I'm not hyping anything up or anything. I'm just being honest. I've been in so many different clinics. I've seen so many different things. The access to the multi-level care that's here
and humans
is it's the rarest of
the humans too.
It is the rarest of things, and that I think is something that cannot be understated.
I appreciate you saying that. I tell the team all the time, I said, my plan, and I know we're going to be around for a while, and I got big plans, but I'm really also very focused on how amazing it is in the moment, because if this is as good as it gets, like, man, it's fucking pretty good. You know what I mean? And I'm just so blessed to have access to the people, the team, the resources, the opportunity, and it really is special. So thank you for saying that. And if you want to be a part of it or check us out, you know, we're here in San Antonio. We have our, well, I'll let Frank do the.
Yeah, wait. You
socials.
could check us out on Instagram at emotion.wellness.therapy. Also our podcast, like you're watching now, on Instagram at emotion.wellness.podcast. Check us out on YouTube, the Emotion Wellness Podcast. Follow Dr. Davila on, what is your Instagram handle?
At drdavila_do. Dr. Davila Dio.
I'm at Frank Parisi 2011. Jason is at @_ motion guy. Follow us, like and subscribe. Go on our website, check us out. I know we're revolutionizing mental health treatment, training. I even like that even better, bro. We need to like brand that. And yeah, we're here, man. We're here to serve. We're here to elevate the minds of everybody out there that's seeking to become better. So
We're doing a lot with our YouTube channel. So we're starting to really parse out different aspects of our team. So we have Lars has been crushing it with creating docuseries. So we did our retreat for Christmas. We had our semi-formal dinner. He's putting that together.
Yeah.
He built us a High Rocks documentary with all the,
Yes.
So that's all going to live on the YouTube channel. And the main goal of that whole thing is to give people who are looking at us, I want them to know us before they really get to us. Right?
Yeah.
Like, this is who we are. No bullshit, transparency. So really, really proud of the stuff that we're putting out and
I love
what
it.
we're working on. So thank you both.
Yeah, thank you, brother. Thank you, guys. It's
a blessing, man.
Great day.
Thank you, Lars.
Lars, you're the man. And thank you, Nugget.
There she is.
Thank you for connecting with us on today's episode of the Emotion Podcast, where we discuss all things mental health. Connect every week as we explore incredibly intimate stories of persistence and hope. Delve into mental health education and explore valuable resources. Available on YouTube, Apple Podcast, Spotify, or wherever you get your podcasts. And visit emotionwellness.com for more information.